Dr. Pandit, what's your experience been? Because, there is a shortage. I mean, we can sit and discuss why there was a shortage in the past. We didn't plan enough. We could have planned during peacetime. But here we are. I mean, there is a shortage. How do you manage this crisis from here on? For instance, your Maharashtra example or experience.
So I think the first thing we need to look at is the supply chain, which needs to be restored. And I'm not an expert in that. I'm a clinician, and I would like to talk like a clinician in terms of how we can use oxygen better in the hospital.
Okay.
So one of the first things which we can do is we can start nursing most of the patients in a prone position so that they can lie down on a tummy. There is a good scientific fact that the moment they do that, the oxygen saturation picks up by a couple of points. And whereby we save even a liter of oxygen on per patient, that would still be a saving of a lot of oxygen. Secondly, we need to probably move the goalpost a little bit. So those patients who require oxygen in a hospital, instead of targeting the 97 to 99 percentile saturation, there is a good evidence in medicine to say that you can actually bring down the target to say 92 to 94%, provided they are neurologically aware and awake and alert. Or those patients who are on a ventilator, the same target can be moved to say 90 to 92%. So that we can save that much of oxygen delivery to every patient which is going on. And that would actually bring down the consumption, have a little judicious use of oxygen. I'm not saying deprive anybody of oxygen, just change the goalpost so that the blood oxygen levels, which we actually calculate by an ABG, arterial blood gas, remain between 55 and 65 millimeters of mercury, which is absolutely physiologically acceptable. Secondly, as Dr. Rana said, fix up the leaks. There are lots of valves which keep on leaking, flow meters which keep on leaking. If every hospital maintenance department takes that much of effort to actually fix this up, you will be saving some amount of oxygen there as well. So these simple measures which can be done right now while the supply chain gets restored, they actually help us in saving the oxygen for the patients who need it. And the last and not the least, that when the patients don't need oxygen, you can actually, if they are getting discharged on a liter of oxygen or so, rather than saying कि आप घर पे cylinder लगा लो, basically ask them to use oxygen concentrator, where the oxygen is concentrated from the air and it can be used by patients' families at home. This way, it will help them to save us the trouble of actually having a cylinder to be put at home.
Very interesting suggestion.
And let the oxygen concentrators be used at home. And this is the reality right now. Many people are holding cylinders at home as a backup. Rather than doing that, they can have the oxygen concentrators at home.
True. I think these are fantastic suggestions in this time of crisis by Dr. Pandit.